Okay. Hi. Welcome to our uh, quarterly consultation with community partners meeting. We're doing it via this video this time. You will have an opportunity to give feedback and ask questions. I hope that you are doing that via this summit that we're having online, these webinars and videos. Live, you can ask questions, and after the fact, I'll provide my contact information, which you all should already have. But please feel free to reach out to me, give some feedback, ask some questions. I'm happy to, if you want, to share that with our other community partners all together. So if you need to get information out to each other, let me know. I can forward that to everyone. So this is for the summit, which is June 18th, 2020. Okay. The current year, the refugee arrivals, the fiscal year 2020 began in October 1st of 2019. However, we're still operating under an extension of fiscal year 19 rather than a new fiscal year 20 contract. They have not issued any fiscal year 20 contracts for refugee resettlement programs. That may change at some point. We don't know, or we'll just continue to work off of the 19 fiscal year 19 agreement. Since October 1st of 2019, we have helped resettle 45 people, or 17 cases. This is the lowest arrival year since the early years of KRM Lexington. The average case is 3 people per case, ranging from a single individual to a family of 7. No significant medical trends have been noted. The countries of origin are the Democratic Republic of the Congo and the Ukraine. Clients' preferred languages: Bembe, Kifulera, Kinyamulenge, Kinyarwanda, Swahili, Ukrainian. Some additional or secondary languages for some clients include Russian, French, Lingala, and Lubukasi. I apologize for my horrible pronunciation of any of those names of languages. Some previous occupations included farmers and market sellers, nurses, hairdressers, as well as a number of other professions that you can see there. Just generally for the U.S. refugee arrivals nationwide as of June 10th, which is the most recent information that we were able to get, 7,608 refugees have been admitted to the United States. This is 42% of the 18,000 ceiling. And remember that that 18,000 ceiling for fiscal year 20 is the lowest in U.S. history, significantly lower than even new lows during this current administration. Because of the presidential determination, this was the first time that there were different categories of refugee arrivals with their own caps within those different sort of categories. Religious persecution, there have been 3,517 individuals, mostly from the Ukraine, although some others as well. Iraqis affiliated with the U.S., 86 individuals. People from the Northern Triangle, Honduras, Guatemala, El Salvador, mostly from El Salvador. It makes up this 237 individuals. And then kind of everyone else, 3,768 individuals, from Democratic Republic of the Congo, Burma, Afghanistan, Eritrea, Moldova, Syria, Sudan, and Somalia. I want to talk a little bit about some programming updates. We are very proud that our Survivors of Torture Recovery Center has opened earlier this year in our office, and they are seeing clients currently. They have a presentation as part of this summit, so if interested in more information, I hope that you watch that video for more information specifically about the work that they're doing. We've also begun recruiting clients for our new rapid employability classes. This is funded through an economic development grant from Lexington Fayette Urban County Government. It starts in July, and it offers employment services for secondary migrants, refugees who were originally resettled in other places but moved here to Lexington and who haven't worked here in Lexington before. And and asylum seekers who have employment authorization. So, as someone has applied for asylum with the United States government, while they're waiting for their case to be adjudicated, after a certain amount of time has passed, while they're waiting, they can receive employment authorization to legally work here in Lexington, and so we can provide services for them as well. We are continuing to work with clients remotely to try to help people understand and complete the census. That's important. We know that that's important to make sure that everyone gets counted. We have summer youth programs that are in the works. ESL classes and citizen classes are all being done remotely or via Zoom right now. Obviously, a lot has changed and a lot has had to be adapted due to, COVID-19 concerns. There is an arrival moratorium except for emergency cases due to public health concerns. KRM Lexington received 2 individual cases in late May. The arrivals were 2 children of a mother who already lived in Lexington. So it's rare, but we did receive those cases. Most of KRM's work has transitioned to remote work whenever possible. However, we do have in-person services that are available for emergencies and by appointment. This includes a Welcome from Home program where volunteers and co-sponsor groups can continue to work with clients but do it remotely from the safety of their own homes. KRM staff has done significant work to help clients who were laid off during the pandemic to apply for unemployment insurance. And they continue to do that work. That's really important. There were a number of clients and other people that needed services, help, with the help of a translator and interpreter to get that information, to fill out all the appropriate forms and things like that. So that's been a big part of what we've done over the last few months. KRM received private donations and grant funding to provide COVID-related emergency housing and utility assistance to immigrants, regardless of their documentation status. And so that's been really important work that we are proud to be doing as well, and very much needed in the community. We also received some grant funding through the United Way and Bluegrass Community Foundation's COVID Fund to help create translated and interpreted information about public health updates in Swahili, Kinyarwanda, Nepali, Arabic, Ukrainian, and Spanish. We've got translated material and some helpful videos available as well. As businesses reopen, KRM will translate or interpret any safety COVID-related signage or safety instructions into any locally spoken language for any employer in Central Kentucky, free of charge. Let us know if you need a sign or an interpreter for employee safety orientation or anything like that. That's been some important work that we're doing as well. So that's the gist. That's really the update. we hope that you are participating in and enjoying and find it meaningful, these live webinar sessions as well as the pre-recorded videos. Please ask questions, make comments in the live chat. Send any questions that you may have or any comments that you would like shared with our other partners to me directly, and my email's right there, and I'm happy to do that. So thank you very much for your time, and thank you for continuing to be a part of our community partner group. Thank you.